Hey guys, I'm just gonna get right into it. I haven't made a video for a couple days because I've been having some weirdness going on with my mastectomy, and I just kind of wanted to figure out what it was before I went and said anything about it. But I talked to my oncologist on the phone today, and it sounds like what I have is post-mastectomy pain syndrome. It usually lasts anywhere from a couple months to a couple years. It's actually in your nerve endings because during the mastectomy, your nerve endings are cut, and a lot of them not only are, removed, but the ones that are there are broke. And in the chest area, there won't ever be any sort of feeling there, but normally in your armpit and your side and toward your back and whatnot, those nerve endings can replace them or repair themselves over time. What's been happening is the pain is actually worsening in my chest wall and has actually moved down to my arm all the way down to near my elbow. And it's gotten so bad in the last few days that I can't feel anything on the skin, but the muscle underneath, it is like up here, just barely even touching it is so incredibly sore. And that is the same with my arm too. It's not the top of my arm. My top of my arm is fine, but as soon as you get to the sides and the underneath of my arm, it is just an incredible amount of pain to even touch it. And when you get up towards my armpit, it is just ridiculous. Even just to shave my armpit, not only is it hard to even get my arm up to be doing it, but the pressure from a razor is, incredibly painful, and I can't put on deodorant. Sleeping is really difficult, but like I had said, it's due to the damage of the nerves, and some things that, can encourage it is if you are a younger age. And so obviously me being only 21 and getting a mastectomy done, obviously very young. I don't think a mastectomy is performed on people much younger than me. And also if you have that lymph node removal, that is shown to be like a critical component in having this post-mastectomy pain syndrome. And I fall into both of those categories, obviously. I'm actually meeting with a doctor either tomorrow or Thursday, I can't remember, but to get my second drain taken out, and I'm going to talk to them about it because there are some things that they can do to assist in the pain. There's a variety of treatments. I was going to go, along the typical path of getting some sort of medical management with it, so some sort of medication to help. They also have nerve blocks, which you can get injected into the site. And then there's also physical therapy. And then they also have some other integrative medicines like acupuncture and massage and stuff, but I don't really want to do those. Those seem like an unnecessary expense to me. I would rather just try some sort of medication and, hope it helps. And other than that, wait for it to leave over time. So, yeah, that's what's been going on for the last few days. I start my chemotherapy now in about a week and a half, and I have a very busy schedule coming up. I am meeting with the doctor to get my second drain out. I'm also going down to the Mayo Clinic at some point here to meet with a few doctors down there to talk to them about my treatment and double check to make sure I'm getting the right treatment done, because the kind of cancer I have is so rare, it's never been dealt with here where I live. So I'm going to be going down to the Mayo Clinic, and hopefully they'll, be able to guide me down a treatment path that'll work for the type of cancer that I have, which is that secretory carcinoma. And then I'm also having an EKG done, and other heart testing that you have to have done before you start chemo. I'm also getting a PET scan at the end of the week here of my entire body, and then I am also getting a surgery to put my port in before I start chemotherapy. I also have to take a chemotherapy class that's required for everyone before they start chemotherapy to let them know everything that's going to happen to your body, which I already have a pretty good idea of and am terrified. And I have a psychologist appointment, and I also have starting the chemotherapy, and that's all in the next week and a half here. So it is going to be a ridiculously busy week and a half. That's my little update for the last few days here. I have a couple videos that I am planning on making, so I will do that coming up here soon. But I hope you all have a fabulous day, and I will talk to you soon.